Imagine this. You look down, notice a different color during your period, and instantly your mind jumps to the worst case scenario. But what if I told you that the color of your menstrual blood is actually one of your body's simplest, clearest ways of talking to you, and it's not here to scare you, but to guide you? Now let me ask you this. What's the most confusing period color you've ever seen, and what did you think it meant? Tell me in the comments because your experience might help someone else feel less alone. Part 1. I want to start by telling you something reassuring. Your period is not supposed to be a mystery. When the color changes, it doesn't automatically mean something is wrong. Your body is constantly adjusting, responding to hormones, stress, sleep, hydration, and even the foods you eat. And the color of your menstrual blood is simply one part of that story. Let's talk about bright red blood, because this is the shade most people expect. When your flow is bright red, it usually means the blood is fresh and moving steadily through your body. You're likely seeing this on the heavier days of your period, especially in the first 2 or 3 days. And if you've ever compared it to a nosebleed, you're not wrong. Fresh blood has that same vivid color. But here's a quick pattern: interrupt. Have you ever noticed your flow suddenly turning bright red in the middle of your period when it was darker earlier? That's not unusual. It can happen when your uterus contracts more strongly, pushing out blood more efficiently. Think of it like your body picking up the pace. Now, if the blood turns dark red, you're seeing blood that took a little longer to leave your body. This darker shade shows up often in the morning, after you've been lying down, or on lighter days toward the end of your cycle. It's not a sign of something dangerous, it's just the natural way blood oxidizes over time, just like how a cut darkens as it dries. I always tell my patients that dark red often just means older blood and nothing more. Brown blood is another color that can make people nervous, but it's actually one of the most common and least concerning colors. Brown simply means the blood has had more time to oxidize. You might see it before your period starts as your cervix begins to open, or after your period ends when the last bits of lining are leaving the body. In fact, brown spotting can be the body's gentle way of preparing for a new cycle. Now I want you to pause for a moment and think about this. How often do you judge your health based on fear instead of understanding? You're not alone, but knowledge takes the fear and turns it into awareness, and that's what I want for you. Part 2. Let's talk about pink blood, because this color often surprises people the most. Pink menstrual blood typically means the flow is lighter and mixed with cervical fluid. This can happen on the first or last day of your period, or during times when your estrogen levels dip slightly. It might show up after exercise or during a stressful week because both can influence hormone balance. Pink doesn't mean panic. It usually just means your flow is watered down. However, if pink spotting continues for several cycles in a row and appears between periods, that can be a sign that your hormones are shifting more than usual. It doesn't mean something serious is happening right away, but it can be a good reason to check in with a healthcare provider. Think of it not as a red flag, but as your body's gentle nudge to pay attention. Now let's look at a color that definitely gets attention: orange. Orange blood can happen when red menstrual blood mixes with cervical fluid or discharge, leading to a peachy or orange-toned result. In many cases, this is completely normal. But if the orange shade comes with a strong smell, itching, or discomfort, it might indicate an infection that needs to be evaluated. Here's something important: color alone never diagnoses anything. You always want to look at the full picture of symptoms. Purple or deep burgundy blood is something people rarely talk about, but it can appear during days of heavy flow or high estrogen levels. When estrogen increases, the blood may become thicker and darker. This can happen during certain phases of perimenopause, postpartum recovery, or after changes in birth control. Again, not a crisis, just your hormones shifting gears. Let me give you a quick personal anecdote I often share. I once had a patient who worried for years because her period looked too dark. When she finally asked about it, she learned it was simply a normal variation. She almost cried with relief because she had carried unnecessary fear for years. The color was never the problem. The silence was. Part 3. Now, let's talk about something people Google at midnight but rarely discuss out loud: gray-tinted discharge or blood. This is one color you shouldn't ignore. If you ever notice gray clumps, gray discharge, or a grayish tone mixed with bleeding, especially if there's an unpleasant smell, it can indicate an infection that needs professional care. But again, don't jump to conclusions based solely on color. Look at everything: discomfort, odor, unusual discharge patterns, or pain. Here's the good news: most period colors are normal. Most variations are simply the result of how fast your uterus is shedding, how much oxygen the blood is exposed to, and what's happening with your hormones that month. Your body is beautifully responsive, and the color of your period is one of the gentlest ways it communicates that responsiveness. Let's talk about clots, because even though clots aren't colors, they can affect what your menstrual blood looks like. Small clots, especially ones the size of a pea or smaller, are usually just your uterus shedding faster than your body can thin the blood. Larger clots, or very frequent clots, may be a reason to check in with a healthcare provider, especially if they're accompanied by heavy bleeding or dizziness. Remember, awareness, not fear. Now here's a question I want you to really think about. When was the last time you checked in with your body without judgment? So many people look at their period with frustration, embarrassment, or anxiety, but your menstrual cycle is one of the most honest indicators of your overall health, sometimes even more predictable than mood, appetite, or energy. Hydration plays a bigger role than most people realize. When you're dehydrated, your period may look darker or thicker. When you're hydrated, the flow may appear brighter or smoother. Even the simple act of drinking enough water supports your hormonal balance. Stress is another powerful influencer. High stress can make your cycle start earlier, later, lighter, or heavier, and it can also affect the shade of your menstrual blood. Stress hormones compete with reproductive hormones, and your period color can reflect that tug of war. So when you see changes, ask yourself, what has my body been dealing with lately? Diet can play a role too. Iron-rich foods can support your flow. Anti-inflammatory foods can ease discomfort. Balanced meals help regulate hormones that influence not just the color of your period, but the length of your cycle and the symptoms around it. Before we wrap up, I want to redirect your mindset. Your period is not something that happens to you. It is something your body does for you. It protects your fertility, it signals hormonal health, and it helps you understand what's going on internally long before other symptoms appear. Your period color is not a test you can fail. It's a message, a clue, a gentle whisper saying, here's what's happening, here's what you might need. And the more you listen, the more empowered you become. So if today's video helped you understand your period even a little better, I want you to comment, I'm listening to my body down below. Because you deserve to feel informed, confident, and safe in your own skin. And I'm here to help you do exactly that.